The United States saw a drastic drop in flu cases between September and June.
Our own Annie Kate joins us live in studio to show us how unmasking could bring back severe respiratory illnesses. Good morning, Annie.
Matt, Kyrian, good morning. I spoke with a couple doctors who say now that many people are ditching masks, it's possible viral diseases like the common cold could spread more easily. They also say it is too soon to predict what this year's flu season may look like. Masks are coming off.
I mean, we could lock down society forever and then viral infections will be very low forever, but there are costs associated with that too. You know, people like to go out and live their lives.
The CDC reports the cases of the flu dropped last year compared to previous flu seasons. Pediatric deaths also fell to almost an insignificant amount last year.
You know, last year was unprecedented with no influenza.
Dr. Steve Hippler credits COVID precautions.
I think we learned through the pandemic with hand washing, social distancing, and masks that it not only reduced the incidence of COVID, but all the respiratory illnesses.
As the world opens up, could we see an increase in these illnesses?
As we start to get back to normal, and if people aren't following those same public health precautions, I would expect we're going to go back to seeing the normal amount of these respiratory illnesses.
But the theory goes, since you've been exposed to the flu, you therefore have some built-up immunity. That probably didn't happen this last year, at least not nearly to the same extent as it has in years past.
I asked both Dr. Hippler and Dr. David Tennant what they predict this year's flu season will look like. Their answer? We'll see.
You know, it's kind of this mass experiment, for lack of a better term, that ended up happening. Like we'll see what happens.
And both doctors I spoke with agree that it is vital to get your flu shot this year. Dr. Tennant says Labor Day is a good time to start pushing for the shot.